Hi, my name is Eric Thompson. Here is the consent form for Chloe Black. Chloe, do you give consent to be in my video today?
Yes.
I'm going to do a 360 view. Okay. First thing I'm going to do is perform hand hygiene, which I've already done. My name is Eric Thompson. I'm a nursing student at the University of Toledo. What is your name?
Chloe Black,
What is your date of birth?
May 17, 2000.
Alright, I'm going to go ahead and check your wristband and make sure that the name and date of birth is the same as you just told me, as a second identifier. Today we are here to do a head-to-abdomen assessment. Next, I'm going to provide privacy by closing the curtains or shutting the door if necessary. And I'm also going to wear gloves, which I am wearing. Okay. Next, do you have any current health problems I should know about today?
No.
Do you have any past medical history of asthma?
No.
Do you have any history of COPD?
No.
Okay, next I'm going to check her orientation and her consciousness. What is your name?
Chloe Black,
Do you know where you are at?
your apartment,
Do you know about what time it is?
7 o'clock,
And do you know why we are here today?
assessment.
Okay. The patient is awake and alert ×4 because she did answer all 4 questions. Next, I'm going to observe her appearance. She seems to be well dressed and well groomed. Her mood is appropriate and her behavior is, she's smiling at me, she's swinging her feet, so she's happy. And I am going to note her speech. As I've been conversing with her, her speech is articulate and it is clear. I'm going to go ahead and I'm going to move on to the face and head assessment. Is it okay if I touch you today?
Mm-hmm.
Okay. I'm going to go ahead and I can see that her eyes are level with the top of her ears, and this tells me that her eyes and ears are symmetric. Her nose is midline, and that is symmetric with the rest of her face. Can you raise your eyebrows for me? Her movement in her eyebrows is symmetrical. Can you puff your cheeks out? And that is symmetrical as well. Next, I'm going to check the condition of your skin. I'm going to note the color is a light tan and it has pink undertones. I'm going to assess for any lesions or sores or drainage coming from any of your piercings. I don't see any sores or lesions at this time. And the color of your skin is even. I am not noting any discoloration right now. Next, I'm going to move on to your head. I'm going to assess your hair. Okay. And we're also going to assess your scalp. I am not seeing any signs of balding through bald patches. I do not see any parasites, and it seems her hair is evenly distributed. I'm not seeing any drainage, open sores, or lesions on her scalp as well. I'll go ahead and check the back of her neck. I'm not seeing any lesions or sores or redness. I'm going to check the back of her ears. I don't see any lesions. I don't see drainage coming from her piercings or anything. So that is all clear. Next, I'm going to perform the eye assessment. If you could for me, please, just go ahead, pull down your bottom eyelids. I'm going to assess your sclera. Okay, your sclera is white and has minimal veining, and your conjunctiva is free of any drainage. I don't see any lesions or sores, and it is a light pink. It is clear. Okay, next I'm going to go ahead and do the positions test. I'm going to check your cranial nerves. I'm just going to make sure that the movement is smooth and that there are no signs of nystagmus, okay? So I'm going to use the 6 cardinal positions. Go ahead, keep your eye on the pen. I'm going to move it and just keep your eye on the pen the entire time. Good. Her eyes were smooth. They were symmetrical with movement. And there were no signs of nystagmus. Next, I'm going to go ahead and perform Perla. I'm going to make sure that your pupils are equal in size, they're equally round, that they are reactive to light, and that they are accommodating. Okay? So, I'm going to go ahead and I'm going to start by measuring your pupil. So just look right over my shoulder as I measure your pupil, please. Okay. Left pupil is about 5 millimeters. Right pupil is also about 5 millimeters. Pupils are symmetrical and they are equally round as well. Okay, next I'm going to check reactivity to light. I'm going to do both direct and indirect. So I'll start with direct light. I'm going to shine the light in your left eye and your right eye, and each eye should constrict, okay? Left eye did constrict with light. Right eye did constrict with light as well. And now I'm going to go ahead and do indirect. As I shine the light in your left eye, your right eye should constrict. Okay, right eye did constrict. I'll do the same thing. Left eye did constrict as well. Good. So your eyes are reactive to light. Okay, next thing I'm going to do, I'm going to go ahead and check accommodation. I'm going to start out here. I'm going to make sure that your eyes converge and that your pupils do constrict. Okay? Go ahead, keep your eye on the pen. I'm going to start here. I'm going to bring it in toward your nose. Your eyes may cross, but it's completely normal, okay? Eyes did converge and her pupils did constrict, so her eyes are accommodating. I'm going to go ahead and move on to the mouth and throat assessment. I'm just going to start with your lips, okay? I can see that your lips are pink. There are no cracking, signs of cracking, and there is no sign of dryness. I can also note there are no sores, there are no lesions around the mouth or on the lips. I'm going to go ahead and check the inside of your mouth now. Do you have dentures?
No.
Okay. And have you had your tonsils removed?
No.
Okay. I'm going to go ahead and start with your teeth. So if you could. Teeth are white. And I will note there are no foul odors right now. Teeth are white. She is not missing any teeth. I do not see any signs of decay. There is no dental caries at this time. Okay, I'm going to go ahead and assess your tongue. Can you stick your tongue up for me, please? Tongue is pink. It's moist. There are no signs of cracking or dryness. There are no sores or lesions, and I don't see any drainage. Go ahead and lift your tongue. The frenulum is midline, and the bottom of the tongue is also pink, and it is moist as well. And there are no lesions or sores under the tongue. Okay, I'm going to go ahead and check your throat now. So just stick your tongue out, say ah. Okay, the throat is clear of any exudate discharge, and it is pink, it is moist. I don't see any lesions or redness or sores, okay? And I'm going to go ahead and check your tonsils, so just do that one more time, please. Say ah. Okay, tonsils are not touching. They don't seem to be swollen or anything. There are no lesions, there are no sores or anything like that. They're regular in size. So I'm going to grade your tonsils as a 1. Okay, and I'm going to go ahead and just check your buccal mucosa. Can you just open your mouth one more time? Okay. Her buccal mucosa is also just moist, and it is a light plain clear of any lesions or anything. Okay, good. Next, I am going to check your breathing. No, actually, next I'm going to go ahead and check your neck. Do I have permission to touch you, palpate your neck today? Okay, go ahead and look up for me. Okay. I'm going to go ahead and palpate your trachea. Trachea is midline in the neck. I do not see any discoloration in the skin. It is a light tan, pink undertones. There's no lesions, sores, drainage. I'm going to go ahead and palpate. I'm going to look for any masses or abnormalities. Which I do not see any or feel any abnormalities at this point. Okay. I'm going to go ahead and check your breathing now. So if you could just sit sideways on the chair, please. Just go ahead, sit up straight, just breathe normal. All right. I can note that she's sitting up straight. She can breathe. She's not using any external oxygen sources besides room air. I can see she is using her diaphragm and her intercostal muscles. And she doesn't seem to be having any trouble breathing at this point. So I'm going to go ahead and begin with posterior thorax. Do I have permission to palpate your spine today? Okay. I'm going to go ahead. I'm going to start at the top, right below the neck, the spine. I'm going to go ahead and just follow her spine down. I'm going to look that her spine is straight, free from any curvature. Look for any abnormalities. Her spine is straight. I do not note any curvature at this time. Next, I'm going to go ahead and check chest expansion. I'm going to go about mid-lower back. If you could for me, just go ahead and breathe in and out. Okay. Chest expansion is symmetrical. Next, I'm going to check her posterior breathing. I'm going to go ahead and do 10 positions, ending mid-axillary. I'm going to check your lung sounds. Okay. Every time I move, just go ahead and breathe in and out, okay? Go ahead. Your lung sounds are clear bilaterally through all lung fields. So if you could, just go ahead and face forward. We're going to listen to your lung sounds anteriorly now. I'm going to go ahead and do 10 positions, and then I'm also going to end mid-axillary again, okay? Go ahead and breathe in and out. Your lung sounds are clear bilaterally through all lung fields. Next, I'm going to check your abdominal region. So if you could, just go ahead, lay down on the bed. Okay. I'm going to make sure that she's in a supine position, that her arms are flat by her sides. I'm going to make sure her lower extremities are covered. I'm going to expose her 4 quadrants of her abdomen. Also, if she had a shirt, I would just lift it up over her chest. Okay. All right, I'm going to begin with color. Right off the bat, I can see that the color of her skin is a light tan, and that tone is even across her abdomen. There is no discoloration, and there's also light pink undertones. I can look at her umbilicus, and I can note the symmetry of her 4 quadrants, and I can see that all 4 quadrants are symmetrical. I can also look at her umbilicus, and I can just look for any redness. She does have a piercing. I don't see any signs of infection. I don't see any lesions or anything like that. Her abdomen is also clear of any primary, secondary, or vascular lesions. Next, I'm going to check the contour or the shape of her abdomen. Her abdomen is flat, and it is non-distended, and I do not note any pulsations at this time. Okay. Next, I'm going to go ahead and ask, do you have any pain in your abdomen today?
Mm-mm.
No pain. Okay. Is it okay if I touch you and listen to your bowel sounds today?
Mm-hmm.
Okay. All right. So she has no pain, so I'm going to start in the lower right quadrant, and I'm going to listen to 2 positions going clockwise. An active bowel will have 5 to 30 sounds a minute. Patient had about 15 to 18 bowel sounds a minute, so her bowels are active. Next, I'm going to go ahead and palpate. I'm going to start in the lower right quadrant, and I'm going to move clockwise. I'm going to palpate 2 positions each quadrant. Just go ahead and tell me if you feel any tenderness or pain.
No.
Pain? Okay.
No. 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 No.
Okay, the patient did not have any pain or tenderness during palpations, and I did not notice any distension, and her abdominal area was soft to the touch. Okay, if you could go ahead, just sit up for me. I'm going to go ahead and check I'm going to go ahead and check for any kidney tenderness or pain. So I'm going to go ahead and do palpations, okay? I'm going to be right below your rib cage. I'm just going to tap on my hand. So just tell me if you feel any pain or tenderness.
Mm. No. No.
Okay. Go ahead and lay back down. I'm going to go ahead and do my closing. I'm going to make sure my patient is comfortable. I'm going to lower the bed to the lowest setting. I'm going to raise the handrails ×2. I'm going to give her her call aid, make sure she knows how to use it. I'm going to make sure anything she needs is within reach. And then I'm also going to document my findings.